And welcome to the show. And this is our health segment where our friends at FHP are bringing you the information that you need to know so that you may stay safe and healthy and live a wonderful island life. And we welcome to the show Dr. Marlene Sinicolas, a eye doctor. now that we have permanently established that and everything like that, Doc, welcome to the show. Happy holidays to you and your team over there.
Thank you. Thank you for having me on.
Okay, and of course, we've been talking about diabetes in a variety of capacities here on the show for the last few weeks. And today we're talking about diabetes and your eyes. I know my father had diabetes. Unfortunately, it was the thing that ended his life, Doc, for some context and everything. But I know as soon as he was diagnosed with diabetes, a physician, someone in your line of work, sat us down and they said, okay, there's a variety of things you need to know, A1C levels, taking blood samples and everything like that. But the one thing that was always emphasized was make sure we get your eyes checked regularly and let us know if you have any vision problems and everything. Broadly speaking, Doc, why is that such a big concern, and what does diabetes do to someone's vision?
Okay, so diabetes is when the blood sugar is too high in the blood. And the A1C kind of gives us a report card of how much blood sugar is floating in the blood system. When it does that, it actually weakens the blood vessels inside the eye. Mm-hmm. And when you weaken a blood vessel, that's the leakage. So if we find leaks inside the eye, which is the retina, then that's a concern that your blood sugar is not well controlled. Mm-hmm. So that's why they emphasize you need to get your eyes checked, you need to get your eyes dilated. And that's when we put eye drops in your eyes. We open up your pupil, we open them up, we widen them, and then we get a good look at your retina, and we're looking for leakage from these blood vessels.
And could this lead to, what type, how negative an impact does it have on someone's vision? Will it lead to like spotty vision, blurriness, or just, blindness in some sense?
Yeah, most people, they'll report intermittent blur. So sometimes that's the first sign of diabetes in the eye is intermittent blur. I've had patients come in and says, last week I just couldn't see with my glasses, and then all of a sudden today my eyes are fine. So that would be the first sign that you may be having blood sugar spikes. Mm-hmm. And what that can do is it can swell the lens of the eye, and it makes the vision blurry. And then when your blood sugar is controlled, then your vision seems to return. Mm-hmm. Most importantly, that's just intermittent blur, but we get more concerned about the retina, which is that's what makes you see. Mm-hmm. And if we see leakage inside the retina, especially bleeding, cause for concern that you and your doctor are not managing your blood sugar very well. I get very concerned with that, because even if I sent you to a specialist who treats the inside of the eye, you still need to control your blood sugar. And that's between you and your doctor. Because even with the treatment inside the eye, there's no, it can take away your vision.
Is this a problem, Doc, that could like come and go? Because most people on Guam, because diabetes is so prevalent in our community, most of us have taken care of someone with diabetes, or we know someone, and kind of the symptoms are if someone's blood sugar drops, they'll be sitting there and all of a sudden they'll be like, oh, like I'm getting the shakes. I need something to eat. Will the eyesight immediately, have some sort of negative effect on it, or is it more compounded? And if you don't take care of yourself over a period of time, then the eyes.
It's actually it's more gradual. Okay. By the time someone comes in to see me and says, I can't see, I'm like, how long have you been a diabetic?
Then you give them the tomorrow lecture, right?
Telltale signs prior to. Always give the tomorrow lecture.
There you go.
Because
tough love from the chamarita. That's the best way.
It starts at home. It starts at home. It starts with, seeing your primary care doctor. By the time you come to see me, if you've had diabetes for more than 5-7 years and you've never had your eyes looked at, I won't know what I'm going to find inside your eyes. Mm-hmm. So at the onset of having diabetes, it is real important that you try, you go and see an eye doctor who can dilate your eyes and really give a good look at the back and make sure that we don't see any diabetes back there.
Well, that being the case, depending on how far along you are, in your walk with diabetes, let's call it, how often should a patient get dilated?
Usually in the beginning stages, if you, I know most of the primary care doctors, usually when you are diagnosed as having diabetes, they usually encourage you, please make an appointment with your eye doctor to get your eyes dilated. Dilated means they put eye drops in and they take a good look at the back of the eye. I've had patients come in who never had a dilated eye exam. And by the time I look in there, they have a host of problems going on.
Mm-hmm.
And then it's at a level where, I need to refer them out to a more specialized doctor, an ophthalmologist, for treatment of what's happening inside the eye. So it's very imperative that, dilation is part of a diabetic's eye exam.
Mm-hmm. Is cataracts, Doc, a necessary byproduct of the diabetic process? Because I know when my dad was going through it, my grandfather, his father, had pretty substantial cataracts, and then my dad got it eventually. I don't know if one, if A determined B, or that was just the impact of old age.
Diabetes, there is such a thing as diabetic cataracts from very high sugars in the blood, but oftentimes, the diabetes is onset, it actually is a complication of your diabetes, and it actually adds on with the age. So there's an age factor for cataracts, and then diabetes can compound it.
Okay.
If your blood sugar is uncontrolled.
Okay. So we know that we have to get dilated. That is a good thing. When it comes to just general care, of the eyes, and maybe the way you use your eyes, like whether you read a lot, whether you spend a lot of time on the iPad, on the laptop these days, if you are diabetic, what are some general tips that you might want to provide to our viewers, just about making sure that you can keep your eyes in like a pretty good tip-top shape?
Well, for me, to take care of your eyes, number one, you got to get enough sleep, enough rest. Number two, you have to have a good balanced diet, and number three, you have to make sure you get your health checked, because you don't want to catch underlying health problems that can affect your eyes. And then number four, you do want to take breaks from looking at computers and screens, and go out there and look at nature, and get your eyes to look out, beyond the screen or outside the house.
And it's carrots that are supposedly really good for the eyes, right?
Carrots, not really carrots. I normally tell the kids broccoli is better.
Broccoli, okay.
Greens are better for the eyes. Carrots is high in vitamin A, but the dark green vegetables have the lutein and the zeaxanthin that are very, very, very good for the eyes. Okay.
Well, Doc, we're going to let you go, but thank you so much for the expertise. And pardon the pun, but I was like, you want to make sure, everybody, that you take care of your eyes, especially if you are diabetic, and you see learned professionals like Dr. Marlene St. Nicholas, because you don't want her to have her eye on you, because she is going to give you that Chamorro lecture.
Well, I do have my patients who come in and they're ready for it.
Oh, well, and we appreciate you taking care of our community. And once again, happy holidays to you and your team at FHP.
Thank you, Jason. Happy holidays.
All right, adjust. Thank you so much, Doc. And please stay tuned, everybody, because we will wrap up this episode of The Link when we return right after this.
We all know that a healthy lifestyle is important to prevent chronic diseases.